Hi everyone, how are you? I pray that you are successful in your study. This is Dr. Ina. Today is Saturday, March the 28th, 2026. Let's study together med search for hematology. This is blood and lymph. Make sure you memorize your lab value, okay? Average RBC is 5 million. If low, anemia. If too high, polycythemia. White blood cell, 5,000 to 10,000. If low, they risk for infection. If high, they already have fever. They already have infection, right? Thrombocyte or platelet, that's the same. Thrombocyte and platelet, about 150,000 to 450,000. If low, they risk for bleeding. And if high, they have blood clot. Okay, so memorize your lab value and know what happened when low and what happened when high and what are your nursing intervention. So when the RBC high, we call that polycythemia. Some people, they have production RBC way too fast, way too much, right? So doctor have to find out what caused the production of RBC a lot. Usually people that live in high altitude, because they don't have enough O2 in high altitude, body will automatic try to make more RBC to get more O2, right? And what they need is phlebotomy to get the blood out, right? Some people, they dizzy like every 2 months, they dizzy, and then when check the lab, everything normal except RBC. Why so high, right? So they need the phlebotomy to take their blood out. That's polycythemia. Anemia, if they lack of RBC, right? They will complain fatigue and chills, always cold, right? So rest in between activity, because if you continue do everything together, then they too tired for them, right? Give them blanket because they always cold, and don't put them in aircon room. So adjust your room temperature, right? People that white blood cell low, they risk for infection. So don't bring flour because there is bacteria in the flour. Don't give them fruit that you can peel, that have the skin, right? No pepper, yogurt, milk, because there is bacteria inside, except if they tell you probiotic yogurt. Okay, teach them to avoid crowd. Check the CBC, white blood cell, check the temperature, right? In hospital, usually we check temperature every 4 hours. And then at least once in your shift, right? And at home, tell them once a day. Every day, they have to check the temperature. If abnormal, report to doctor, right? And teach them also sign and symptom infection. Correct? We monitor sign and symptom infection. If there is a sign and symptom infection, report to doctor. Don't give them live vaccine, MMR, chickenpox, or PV, right? Because they easily get infection. So no live vaccine. Ask for sore throat, because that's usually the easiest infection that people can get, right? If they are in hospital, we put them in reverse isolation room. That's the positive pressure room, so the air from outside will not go inside. Okay, teach them wash your hand, wash your hand, wash your hand, right? Usually they only drink water from the bottle, right? If they already open the bottle and they don't know how long they open it, just throw it away, just get the new one. Every time they drink, close it really well so there is no dust, no bacteria can go inside the water. So always precaution, do not let them get sick. If you visit them in hospital, usually outside they will write neutropenia precaution, means the patient have neutrophil low, right? So they easily get infection. So before visitor can go inside the room, they have to wash their hand, use the mask, right? If somebody sick, don't visit them because the patient easily got infection. Don't bring food from outside, right? Usually hospital will prepare special food for them. So it's really clean, no risk for infection. So know all your intervention for people with low white blood cell, because they risk for infection. If they already have fever, right? Usually they already have high white blood cell. They already infection with the high white blood cell. People with low platelet, thrombocytopenia, they risk for bleeding. And there are many nursing intervention that you have to know for people that risk for bleeding, right? Soft toothbrush, electric razor, no spot contact, check their skin, petechiae, that's the pinpoint, right, under the skin. And then ecchymosis, that's the bruise, bigger than bruise, we call that purpura, right? Petechiae, ecchymosis, purpura. Check their gum, maybe bleeding, check hematuria, maybe urine have blood, hemoptysis, their sputum have blood, hematemesis, they vomiting blood, hemothorax, they have blood in the pleural space. Don't give them injection if possible, but if you have to inject them, use the smallest needle, 29 gauge ½ inch, right? And then you press maybe 3 to 10 minutes until the bleeding stop. If possible, no IV. If you give IV, then use the butterfly that usually we use for baby, right? Check melena. Melena means fresh blood in the poop. If doctor suspect maybe there is blood in the stool, but we cannot see with our eye, then we will do guayak test. But for guayak test, before the test, no turnip, no beets, red radish, so something that red meat, right? Tomato, fish, vitamin C, cantaloupe, because this food can cause false positive, right? So we teach them before guayak test, do not eat something that red, because we don't want to misunderstand and we think it's bleeding, but actually because of diet. Alright, if doctor order white blood cell differential, what does that mean? That means I need to know detail of the white blood cell, right? Your white blood cell, you have the granulocyte and agranulocyte. So you have cell that have granule inside, right? Granule, and then the one that granulocyte is neutrophil, basophil, and eosinophil, right? Neutrophil 40 to 60%, so that's the most common white blood cell that we have. Neutrophil 40 to 60%. So when you see the word neutropenia, that means the neutrophil already low, right? And this neutrophil to fight infection. So this is very important white blood cell that we have. Basophil, usually normal is 0 to 1%. It increases when people have allergic, right? Basophil is the one that produces histamine. So your treatment will be antihistamine. That's your Benadryl, diphenhydramine, right? Diphenhydramine. So basophil usually increase when somebody is allergic. Asthma usually allergic, right? And then eosinophil, normal is about 1 to 4% or 0 to 4%. And this increase when parasite infection. When allergic, eosinophil also can increase, right? But especially parasite infection, eosinophil can go up. And we learned in pharm, right? Some medication can cause eosinophilia, right? Eosinophilia means the eosinophil increase. And then the one that no granule inside the cell, that's your monocyte and your lymphocyte. Monocyte is a big giant cell. There is no granule inside, right? And this cell, monocyte, is the job is eat the germ. So it can engulf the germ just like your neutrophil, right? And we call this macrophage. Macro is big, phage is eat, right? So this is your phagocytes, the cell that can eat the germ. I usually call this Mr. Pac-Man here, right? Mr. Pac-Man eat the germ. So when you step on something dirty, the monocyte will come and the neutrophil also will come to eat the germ. And then lymphocyte. Lymphocyte, you have 30%, right? 30% of lymphocyte. You have T cell and B cell. Why we call this T cell? Because mature in thymus, right? And T cell, you have CD4, CD8, memory cell, natural killer cell. But the one that famous is your CD4. Normal CD4, 600 to 1200, right? HIV will attack CD4. And when the CD4 under 200, we call that AIDS, right? Acquired immunodeficiency syndrome. So AIDS is the end stage of HIV infection. If the CD4 still above 200, we cannot call that AIDS. We only can say HIV infection, right? But if the CD4 already under 200 and they have opportunistic infection, right? Like PCP, pneumocystic carinii pneumonia, Kaposi sarcoma, right? Candidiasis. So when they already have those opportunistic infection and CD4 already under 200, we call that AIDS. Acquired immunodeficiency syndrome. When it's still above 200, we only can say HIV infection, right? So that's the T lymphocyte, and it's responsible for cellular immunity, right? When there is organ rejection, people don't donate their organ, and our body reject the organ, that's because of the CD4, right? So this CD4 responsible for cellular immunity, localized immunity. CD4, T cell, right? So T cell for the cellular immunity. And then B cell. B cell, this is plasma cell that produce your antibody. And antibody is inside your blood everywhere in the body. So this is responsible for humoral or systemic immunity. Okay, so B cell, plasma cell produce antibody for humoral systemic immunity. T cell, that's for cellular immunity, localized, and also for organ rejection. All right, your lymphocyte is 30%. Monocyte usually 2 to 8%, so it's below 10%, right? That's your monocyte. Mr. Pac-Man here, macrophage, phagocyte, engulf the germ. Okay, that's your monocyte. So when doctor order for white blood cell differential, that's what it means. I want to know detail how many percent of my granulocyte and agranulocyte, right? Again, granulocyte is your neutrophil, 40 to 60%, basophil 0 to 1%, increase when allergic, right? Eosinophil normally 0 to 4%, increase when parasite infection. And then the one that no granule is your monocyte and your lymphocyte. Monocyte 2 to 8%, under 10, lymphocyte 30%, and your lymphocyte have T cell for cellular immunity, localized, right? Organ rejection is your T lymphocyte, and then your B lymphocyte for humoral immunity, systemic immunity, right? There is plasma cell there that produce the antibody that will be in the blood everywhere, systemic. Let's talk about sickle cell anemia, right? Remember the mnemonic HOPS, H, H, O, P, and S. That will make you easily remember about sickle cell anemia. Avoid heat. So when summertime, when the patient have fever, they can easily get the attack, right? Very painful. And then hydration is very, very important, because if they dehydrated, then the red blood cell that look like half moon, it will clumping easily when dehydrated, right? That's why they need to drink a lot of water, hydration, to make the red blood cell detach from each other, right? And then they need O2. The pain will be very excruciating pain that they need morphine, right? Don't give them Demerol, meperidine, because the meperidine have cumulative effect and they can have seizures, okay? So doctor will not order for meperidine, Demerol, because cumulative effect, the patient can have seizures. The pain is very excruciating, so they need morphine. And then avoid stress, right? The patient need to avoid stress, because when they stress, maybe they also will be dehydrated, and that will be easily they get the attack. The pain will be very severe, right? So remember your HOPS. Avoid heat. Hydration is very important. O2. Pain management is your priority. And then avoid stress. Many African American per statistic have this problem, 1 out of 500. But if they have this problem, usually they not easily get malaria, right? There are 3 stages in sickle cell anemia. Stage number 1 is vaso-occlusive crisis. So vaso is blood vessel, occlusive is occlusion, obstruction, right? So why they are very, very painful here? We call that crisis. That means your priority is pain management. What caused the pain? Because of the occlusion in the blood vessel. That's why we call this vaso-occlusive states, right? Vaso-occlusive, occlusion in the blood vessel. Stage number 2 is sequestration stage. This is splenomegaly, right? So splenomegaly means their spleen enlarged. They work very hard. Now the spleen really big. So sometimes doctor have to do the splenectomy, right? Throw away the spleen. But this spleen is our blood bank, 500 ml blood, right, in our body. So if we lost our blood under 500 ml, we don't need blood transfusion because we have the blood bank, right? But if doctor do the splenectomy, no more spleen, then they will be in trouble. If they lost blood 200, they're already in trouble because there is no blood bank, right? So splenomegaly, what is your priority now? Do not palpate, right? Do not palpate. Stop fidgeting. Don't move too much. Sometimes we don't even let them go to restroom because if they move too much, the spleen can rupture, right? So do not palpate. You don't want rupture. If your patient has splenomegaly, they cannot work something that push something heavy, lift something heavy, right? And wait until doctor deal with the spleen, right? Maybe do the splenectomy or the spleen already becomes small, but usually take a long time for the spleen become small. And the stage number 3 is aplastic. That's already bad, right? Aplastic means RBC already low, white blood cell low, thrombocyte low. So now they have anemia, they also risk for infection, they also risk for bleeding. Okay, so 3 different stages for sickle cell anemia. Sickle cell anemia and cystic fibrosis, they are autosomal recessive, means mom and dad guilty, right? If mom have one gene that healthy and one gene that's sick, right? One gene that bad. That means mom only carrier. Carrier is the same with trait. Remember, carrier the same with trait, right? So if I say somebody have sickle cell carrier or sickle cell trait, means they have one healthy gene and one that bad, right? But they don't have sign and symptom. So it's possible that the mom carrier, dad also carrier, they maybe don't even know that they have the sickle cell or cystic fibrosis, right? So when they married and now pregnant, right? If mom give the bad gene and dad also give the bad gene, that's when they will have a child that with sickle cell disease, right? So if I say sickle cell disease, that means they have sign and symptom now, right? If mom give the good gene and dad give the good gene, then healthy, totally healthy, right? But if mom give one good one and dad give the bad one, now carrier. And also opposite, right? If dad give the good one, mom have a bad one. So if one good and one bad, they only carrier, only trait. They don't have sign and symptom, right? But the bad thing is one bad gene from mom, one bad gene from dad. That's when meet together, bad and bad, they will show the sign and symptom. So we call that sickle cell disease. So autosomal recessive. So the best is prevention, right? Genetic counseling before they married, right? If they already know that they carrier, they not supposed to marry with another carrier to avoid the sickle cell disease. So prevention will be the best. If they already married and now already pregnant, what can we do? They can do the amniocentesis early pregnancy to check whether the fetus have abnormality chromosome. All right. So if they want to know if this baby have sickle cell anemia or not, they can do the amniocentesis early pregnancy to check abnormality chromosome. All right. So this is about sickle cell anemia. Now let's talk about hot skin. This is cancer, right? Cancer in the lymphatic system. Usually the patient will complain fatigue, very tired, even though they already sleep 10 hours, 12 hours, but why they still tired? And then usually they will see bulging in the neck area. So that's the cervical lymphadenopathy, right? So when they go to doctor, you want to encourage them go to doctor even though it's painless. Many times it's painless, right? And when they go to doctor, doctor will do the biopsy, and hopefully they will not find Reed-Steinberg cell. Reed-Steinberg cell. Memorize that name, right? Every time you see the cell that Reed-Steinberg, that's the name, that's Hodgkin. That's 100% Hodgkin, Reed-Steinberg cell. So confirmation with biopsy. All right. And the staging is very, very important because based on the staging, doctor will decide the treatment, right? Diaphragm is something that separate thorax from abdomen, right? So stage 1, if the one lymph node above the diaphragm got affected, only one lymph node above the diaphragm. Stage 2, if more than one lymph node already affected, but still above the diaphragm. Stage 3, if already affected lymph node above and below the diaphragm. And stage 4, when it's already metastasized everywhere, right? So staging is very important because usually stage 1 and 2, radiation, and then stage 3 and 4, chemo. Sometimes doctor also give radiation, so chemo and radiation, right? But 1 and 2 usually radiation, and then 3 and 4 chemo. All right. Prognosis is good. Prognosis is excellent because now they find out how to deal with Hodgkin, right? Prognosis actually excellent for Hodgkin. If you see the word Benz-Jones protein in the 24-hour urine sample, this is for multiple myeloma, right? Multiple means more than one. Oma is cancer. Myelo is bone marrow, right? Myelo is bone marrow. Don't say muscle. Muscle is myo, right? Myelo can be bone marrow, can be spinal cord, but in this case, it's the cancer in the bone marrow. So you will find Benz-Jones protein in the 24-hour urine sample. All right, let's talk about anemia pernicious. This is anemia that lack of vitamin B number 12, cyanocobalamin. That's the generic for B12, right? Cyanocobalamin. In our stomach, we have intrinsic factor that will help absorption of B12, right? So some people, maybe they have cancer in stomach, or maybe they want to lose weight without exercise, then they do the lap band, right? So if we cut the stomach, now we don't have intrinsic factor. So the patient usually will have problem with lack of B12, so they can have anemia pernicious, right? Vitamin B is very, very important for nerve. So people who have anemia pernicious, they can have numbness and tingling, right? Because the nerve will be problem, and they even can become paralyzed. So we have to teach them. They have to take medication diligently. They have to follow instruction, because if not, the nerve can be problem. They can become paralyzed because of this lack of B12. Okay, Schilling test. If you see the name Schilling test, that's for anemia pernicious. Okay, B12 radioactive. And then the patient, usually the tongue will be very, very red. We call that beefy tongue, right? They have numbness and tingling because this is the nerve problem. When they just have the surgery, the stomach, right? Usually what we do is every day, doctor will order for B12 every day, IM, right? Every day for 7 days. After that, then every week only one time, but for 1 month, right? And then after that, then they need to take B12 IM monthly, just one time, but for life, right? So because it's for life, then we can teach our patient or the family how to give the injection IM. So they don't need to continue come to doctor every month, right? For life. So we teach them, patient teaching, how to give IM injection, right? 90-degree, intramuscular, you need to aspirate because we don't want the medication go to the blood vessel, right? So teach them how to give the IM B12 for life. All right. Because you cut the stomach, now their stomach become very small, sometimes totally no stomach, right? So can you imagine if they stand up and they eat something, it will go to the anal area, and then they will poop right away, right? So they don't get enough nutrition. So we have to teach them. We call this dumping syndrome, right? It's always in the test, so make sure you know this really well. If they eat and if you let them stand up or high fowler, it will go right away to the anal area. So we don't want that happen, right? So how to help people that dumping syndrome? When you feed them, lay down. Of course, you don't want them choking, right? Be careful, you don't want them choking. But when you feed them, don't put them high fowler, right? And then after feeding, they still need to lay down because I want their GI, right, horizontal, right? Let the food still there and they absorb so they can get the nutrition, right? So at least 20 minutes, like 15 to 20 minutes after they eat, they still need to lay down. Don't give them too much fluid when you feed them, right? Because if you give them food and then they drink, food and then drink, then you will flush the food, go down really quick, right? So usually we separate the food, eat the food first, and then you can drink later, not too much, right? And diet, remember, low carb, low carb. Why low carb? Because in our mouth, we have ptyalin, right? That's your amylase that break down carbohydrate. So if you give me carbohydrate, I will quickly break the carbohydrate. And you don't want that happen for people that have dumping syndrome, right? In the pancreas, they have 3 enzymes, right? Amylase that break down carbohydrate, lipase that break down lipid, and protease that break down protein, right? So for this patient, just give them low carb so they will not quickly digest the food in their mouth, right? You can give them high protein and just give them moderate fat. Okay, only moderate fat, because high fat is not good, right? That's high cholesterol and risk for cancer, right? If high fat diet. So just low carb, high protein, moderate fat, and small frequent diet will help. Okay, small frequent diet. Teach your patient, they need to comply with the treatment, because if they forget, if they neglect, if they don't do the injection IM for life, they can become paralyzed. So don't underestimate this anemia, right? We think it's only lack of vitamin B12, but it can be serious if they don't take the medication. Okay, so anemia means their RBC low, right? Lower than that 5 million. If somebody bleeding, they can have hypovolemic shock, right? Tachycardia is the early sign of shock, and hypotension, that's already late sign, right? So if somebody bleeding, they can have this hypovolemic shock, right? Some anemia can be lack of iron. If they lack of iron, usually they love to chew ice chips, right? And if you look at their blood, if you take their blood and smear at the plate and you look under microscope, usually for anemia that lack of iron, they have the microcytic hypochrome. right? Microcytic means very, very small, the RBC, and hypochrome, the color is not so red, okay? Some people, they have anemia that lack of B number 9, folic acid, and B number 12, that's cyanocobalamin, right? If a pregnant woman not enough B number 9, the baby can have spina bifida, all right? If a woman when pregnant not enough B number 9, that's why doctor will make sure to give the prenatal vitamin, right? Include this B number 9 folic acid. Because if lack of B number 9, baby can have spina bifida. We call that neural tube defect, right? Neural tube defect. And spina bifida have two types, occulta and cystica. Occulta means only the pouch but nothing inside, right? Cystica have two types. You have meningocele, so there is meninges inside, risk for meningitis. And the worst is myelomeningocele, right? Because now inside the pouch there is meninges and also there is spinal cord, right? And the CSF cannot flow really well, right? Because it's tangled here. The spinal cord is inside. So this is dangerous. Myelomeningocele, you have to put your baby prone, right? Put your baby prone. Usually we need the normal saline and sterile gauze and put it there so it moist for oxygenation and prevent infection, right? And doctor need to do many surgery to deal with this problem, right? Because you cannot just push the meninges and the spinal cord inside, right? They have to be very careful. You don't want this child become paralyzed. And because the CSF cannot really flow well, 80% of this spina bifida myelomeningocele baby, 80% they can have hydrocephalus, right? Big head with the CSF inside. So usually for hydrocephalus, they will put the tube from the ventricle of the brain and let the extra CSF, throw it to the peritoneal cavity. That's why we call that ventriculoperitoneal shunt, right? You have to monitor for peritonitis because you put the extra CSF inside the peritoneal cavity, right? Monitor for peritonitis. And many of these spina bifida baby, usually they will allergic to latex, okay? So latex allergic happen a lot to baby that's spina bifida. And if they allergic to latex, they also allergic to BP pack. This is my mnemonic, right? To remember the diet. If they allergic to latex, they also allergic to BP pack, banana, pineapple, passion fruit, avocado, chestnut, kiwi, right? Also potato, tomato, strawberry, and peach. So people who allergic to latex, usually they also allergic to BP pack, banana, pineapple, passion fruit, avocado, chestnut, kiwi, potato, tomato, strawberry, and peach. Why? Because the chemical of these fruits similar like chemical in latex. So usually if they allergic to latex, they also allergic to this fruit. Not always, but can be, right? So that's regarding spina bifida, can happen because mom when pregnant lack of B number 9. There are anemia that lack of B12. That's the anemia pernicious with beefy tongue, numbness and tingling, right? Aplastic anemia means they already low RBC, low white blood cell, low thrombocyte, right? They have anemia, they have risk for infection and risk for bleeding. And then sickle cell, we already talked about sickle cell anemia, right? And pernicious is the one that lack of B12. If you look at the under microscope, right? For people that anemia, lack of B number 9 and B number 12, right? The RBC will be big and the color will be more red than normal. So we call that macrocytic hyperchrome. Macrocytic hyperchrome, right? For lack of B9 and lack of B12, the RBC is macrocytic, it's big, and hyperchrome. The color is more red than it should be. People that deficiency iron, the RBC small and pale, right? Microcytic hypochrome for anemia that lack of iron. For anemia that lack B number 9 and B number 12 is the opposite, macrocytic hyperchrome. Macrocytic hyperchrome, big and the color is more red, right? Macrocytic hyperchrome, lack of B9, lack of B12. The one that iron, microcytic hypochrome. Microcytic it's small and hypochrome it's pale. So remember those different, okay? When you look at their blood You smear at the plate and you look under the microscope. Alright, now about iron. When you give iron to your patient, teach the patient, don't freak out if they have black stool, right? That's how they digest the iron. That's how GI digest the iron. So the stool will black color. Teach them, not terry stool, okay? Because terry stool can be bleeding, right? But the color black stool, and then they risk for constipation. So teach them eat high fiber and drink a lot of fluid, right? Iron, if this is liquid, it's staining the tooth. So usually when they drink this, they need a straw, right? And the best absorption for iron actually empty stomach. But if it's irritate their GI, then you can teach them drink with orange juice, right? You can take it with milk if it's irritate your GI. The best is orange juice, vitamin C, right? But better than that, actually empty stomach is the best. All right, so don't drink iron with milk. You cannot tell them do not drink iron with milk, but you can drink with vitamin C or take it with food. And use the straw, right, because it can stain the teeth. Spinach have a lot of iron. Your organ meat also have a lot of iron. So sometimes you need to teach them diet that have iron. Okay, we need iron to make RBC. So that's why pregnant woman, doctor will give iron. Even after they deliver the baby, we still give them iron, because when they deliver the baby, they lost their blood 300 to 350 ml. So they need to make more blood, right? They need iron. If they need it really urgent, really bad, no time to wait for diet, right? Because diet will a little bit slow. So we give them C-track, right? Iron C-track. Why need C-track? Because it burn the skin, right? It will be painful if you give iron and if the iron touch the skin. So don't let that happen. So we need to use C-track. What is the meaning of C-track? You pull the skin laterally really tight before you give the injection, right? The needle that you use, it has to be a long needle, right? 1 inch, and make sure the bevel it has to be clean, no medication at all. So if you prepare this medication yourself, right, change the bevel, the one that you use when you take the medication, change that with a new one. So the bevel, it has to be clean. And then when you go to the patient room, right, you hold the needle upside down and there is air there. You purposely put air there. We call that airlock, right, about 0.1 ml. If this is come from pharmacy and they have that air, do not release, do not throw away the air. Okay, don't worry about air emboli here, right? They purposely put a little bit air there, so the medication later will really go inside deep in the muscle, intramuscular, right? Because we don't want the medication come out and staining the skin and painful to the patient, right? It can be necrotic. So we put the airlock 0.1 ml. When we give IM 90 degree. We aspirate. We don't want the medication go to the blood vessel and then flow to the whole body, right? We want the medication intramuscular. All right. And then when you already give it, when you pull it out, wait for 10 seconds before you release, right? Why you need to do that? Because when you already release after 10 seconds, it make a Z, right? It make a Z. That's why we call this C-track. So the medication will not easily come out, right? Do not massage, because we don't want any medication come out and touch the skin of the patient, right? So if the medication want to come out, they have to go horizontal first, diagonal, right? So we make it difficult for the medication to come out. So don't massage. If there is question about compress, should you use compress that cold or warm? It has to be cold, because you need something vasoconstrict, right? But usually we don't want to press anything. We don't want the medication come out. It's possible that a patient can have toxicity with iron, especially if they receive a lot of blood transfusion, right? It's possible they toxicity with iron, and your antidote is desferal-desferosamine, okay? Desferal-desferosamine, that's the antidote if they toxicity with iron. We call this chelation therapy. Chelation only means something that bind the chemical, right? So for this toxicity iron, we use desferal-desferosamine. Okay, so that's information hematology for you. Hopefully useful. Listen many times, because repetition is the mother of retention. All right, hopefully this will useful for you. Alright, see you next time. God bless. Bye.